We're deeply concerned that these layoffs have come in the worst crisis in nursing history.
A small community hospital about an hour north of Toronto is about to lose 13 nurses. Stevenson Memorial, which services Alliston and other parts of Simcoe County, announced the layoffs last week, citing funding cuts as the reason. Angela Preo-Cannon with the Ontario Nurses Association tells me this was a complete surprise, and she fears it could be a sign of things to come.
If we can lay off at this hospital, why can't we lay off at others? And that's not we, the employer. Let's be clear. It's not the union laying them off. It's the employers that are laying them off.
According to the Ministry of Health, funding for those nurses was part of temporary extraordinary measures that was given to hospitals to deal with increased volumes during the pandemic. But the ONA says they were led to believe the funding would be permanent.
The beds that were allocated, and our understanding is that the high acuity unit, which is a level 2 ICU, was intentionally created for their long-term redevelopment. And those nurses were hired specifically for that unit. They were not extra nurses that were hired temporarily. Absolutely not. The surge beds for the overcapacity for COVID, certainly part of some temporary funding. However, that doesn't justify the layoff of 13 nurses.
When Stevenson Memorial opened back in 1964, it only serviced about 7,000 people. That number has now grown substantially to more than 40,000 patients a year. The funding cut will impact 8 ICU and overflow beds. And while those units may no longer be operating at full capacity, the nurses hired to staff them were often redeployed to other sections of the hospital, like the emergency room.
It's an expanding community. And so to decrease the amount of staff available is just unfathomable.
For many months now, the healthcare system has been dealing with a major staffing crisis, mainly due to burnout, with some of the major hospitals in the GTA seeing a 20% vacancy rate. The province has been working to attract and retain nurses, saying tens of thousands have been hired in recent years. The Ford government also recently announced it would make it easier for thousands of internationally trained nurses to practice in Ontario. But Preo-Cannon says it's still not enough, and she's hoping this week's budget reflects the province's commitment to the future of healthcare.
It's a wait-and-see game.
Stevenson Memorial is currently undergoing major redevelopment to better serve the growing community, and the province has committed an additional $6 million to help with the cost of expansion. Shauna Hunt, City News.